A family of 4 in Tampa just saved $1,400 a month in healthcare costs. They did not change jobs. They did not move. They did not give up their doctor. They stacked 9 specific programs that most Americans have never heard of. Programs that exist right now, in April of 2026, and programs that most people qualify for without realizing it. $9,800 a year. Staying in their household, instead of going to premiums, co-pays, and prescription counters. The healthcare system in this country is expensive on purpose. It is also layered. There are federal programs, state programs, hospital programs, pharmaceutical company programs, community programs. Most of them are underutilized. Not because they do not exist, because the average family has no idea they are eligible. The family in Tampa figured it out. 9 programs. Let me walk you through every one. Program 1. Medicaid Expansion. In 41 states plus the District of Columbia, Medicaid now covers adults with household incomes up to roughly 138% of the federal poverty level. For a family of 4 in 2026, that ceiling is about $44,300. If your household income is under that number, Medicaid likely covers you at no monthly premium. 0 deductible. Co-pays of $5 or less on most visits. The family in Tampa qualified because the stay-at-home parent's income, plus the working parent's part-time hours, kept them under the threshold. They had been paying $600 a month in marketplace premiums. Switching to Medicaid, 0. Application takes about 30 minutes through your state's Medicaid portal. Approval is usually granted within 30 days. No waiting period. Coverage begins immediately upon approval. Program 2. CHIP for Children. The Children's Health Insurance Program covers kids in households with income too high for Medicaid, but too low to afford private coverage. CHIP ceilings run up to 300% of poverty in many states, over $95,000 for a family of 4. Premiums are typically under $50 per month per family. Dental and vision are usually included. If you have children and you are not currently enrolled, check eligibility. The family in Tampa enrolled both kids in CHIP. Monthly savings on pediatric visits, orthodontics, and eye exams. Roughly $300. Program 3. Federally Qualified Health Centers. Federally Qualified Health Centers, often called FQHCs, are community health clinics that serve everyone regardless of insurance status. They operate on a sliding fee scale based on household income. A family that would pay $250 for an urgent care visit at a commercial clinic typically pays $15 to $35 at an FQHC. There are over 1,400 FQHC networks operating across the country. Find your nearest one at findahealthcenter.hrsa.gov. The family in Tampa uses an FQHC for primary care. Annual savings versus their previous clinic, about $400 a family member. Program 4. Hospital Charity Care. Every nonprofit hospital in America is legally required to offer financial assistance programs. Most do not advertise this. If your household income is under 4 times the federal poverty level, around $125,000 for a family of 4, most hospitals will reduce or completely forgive medical bills. The catch: you have to apply. The application form is usually called Financial Assistance or Charity Care. It is often a single page. Submit it within 180 days of the service. The family in Tampa had an emergency room visit last year that generated a $4,200 bill. They filed the charity care form. The hospital wrote off the entire balance. Program 5. Pharmaceutical Patient Assistance Programs. Every major pharmaceutical company runs a patient assistance program for people who cannot afford their medications. Pfizer has RX Pathways, Lilly has Lilly Cares, Sanofi, Novo Nordisk, Johnson & Johnson, Merck. All of them have similar programs. Income thresholds typically go up to 500% of poverty, over $150,000 for a family of 4. Medications that cost $500 a month retail are often provided for free under these programs. The family in Tampa's adult with a chronic condition had been paying $280 a month out of pocket. After enrolling in the manufacturer's patient assistance program, 0. Program 6. ACA Premium Tax Credits. If Medicaid is not an option and you are shopping on the marketplace, make sure you are claiming the premium tax credit you are eligible for. Most households under 400% of poverty qualify for meaningful subsidies. A family of 4 earning $80,000 a year can often get marketplace coverage for under $200 a month after subsidy, versus a sticker price of $1,200 to $1,500. The trick is recalculating your credit every year based on actual income. Many families leave hundreds of dollars on the table by underreporting expected income at enrollment. Program 7. Medicare Savings Programs. If you have a parent, grandparent, or older relative on Medicare savings programs can cover their Part B premium, Part B deductible, and most copays. The income thresholds are higher than most people assume. Many seniors qualify without realizing it. Enrollment happens through the state Medicaid office. The family in Tampa got the grandmother living with them enrolled. Monthly Medicare out-of-pocket reduction, about $170. Program 8. Free dental and vision through schools and FQHCs. Dental and vision are the 2 largest gaps in most health coverage. FQHCs increasingly offer dental services on the same sliding scale as medical. Many school districts run free dental and vision screening programs for students through partnerships with local nonprofits. University dental schools offer full exams, cleanings, and even major procedures performed by supervised students at 30 to 60% below commercial pricing. The family in Tampa uses the University Dental School for cleanings and the FQHC for anything more involved. Program 9. State Pharmaceutical Assistance and Insulin Caps. Most states now have their own pharmaceutical assistance programs that stack on top of the federal and manufacturer programs. Insulin specifically is capped at $35 per month in most states for Medicare beneficiaries and in many states for the broader population. If you or anyone in your household takes insulin and you are paying more than $35 a month, check your state program. You are overpaying. The Weekend Action Plan. This afternoon, log into your state's Medicaid portal and check eligibility. Even if you think you earn too much, check. Most families are surprised. Tomorrow, find your nearest FQHC and save the number. Monday, if anyone in your household takes prescription medication that costs more than $50 a month, look up the manufacturer's patient assistance program. Tuesday, if you have a hospital bill from the last 6 months, download the Charity Care application. Wednesday, if your kids are not on CHIP, submit the application. By next Sunday, you could be stacking 3 to 5 of these programs. The family in Tampa did it over a single weekend. $1,400 a month. 9 programs. Free. These are not loopholes. These are programs funded specifically so American families can use them. The only reason they are underused is because nobody tells you they exist. Now you know. If this helped, hit subscribe for the next bill breakdown. Tools we use for household planning linked below. See you on the next one.